Welcome to the University Hospital Spine Surgery Education presentation. My name is Megan Doman and I am one of the Orthopedic Spine Nurse Navigators. Thank you for joining me as you prepare for your spinal surgery. Feel free to write down any questions you have. I will provide contact information for the nurse navigation team at the end of this presentation. This presentation will educate you and your family on your upcoming spinal surgery, hospital stay, and recovery. We will be covering topics that include pre-op, surgery, post-op, your role in recovery, physical therapy, discharge plans, medical equipment, and physical and occupational therapy videos. We will now discuss who will be involved in your care during hospitalization. Your neurosurgeon and/or orthopedic surgeon will be performing your surgery. Oftentimes, the surgeon's PA or NP will assist during your case. This team is in charge of your plan of care before and after surgery. The anesthesiologist or CRNA will administer the medication that puts you to sleep in the OR. They also reverse the effects of these medications to allow you to slowly wake up in recovery. Anesthesiology may call you the evening before surgery to obtain a medical history, review your current medications, and also remind you to not have anything to eat or drink after 12 midnight unless otherwise instructed. Anesthesia will also speak about when to take your pre-surgical insure on the day before surgery and the day of surgery. The Orthopedic Spine Nurse Navigator is a nurse who educates patients and also coordinates services under the direction of your physician. Your rehabilitation team consists of physical and occupational therapy. Physical therapy will teach you the exercises you will need to regain balance, stability, and strength. They will assist you in making a recovery plan following spine surgery and will also evaluate the need of any medical equipment. If your surgeon orders occupational therapy, they will teach you ways to move in a more effective manner while accomplishing daily activities, often with the aid of adaptive equipment. Your nursing team from the Orthopedic Spine Center, located on the 9th floor, will carry out the plan of care as ordered by your surgeon. You will be in a private room after surgery and during your entire stay at University Hospital. A case manager and social worker make up your discharge planning team. They work together and with you to develop a safe plan following discharge from the hospital. A dietitian will see diabetic patients and anyone who has specific dietary needs. The pharmacist will ensure medication safety during hospitalization, and chaplain services can be consulted at any time if you feel you are in need. A manufacturer's representative will be present in the OR. Their role is to bring any hardware that is implanted during your surgery. They leave after hardware is properly implanted and do not perform any portion of your surgery. As a patient, we want you to understand a little bit about your spine. Here we'll have a brief spinal anatomy lesson. Your surgeon will discuss in detail the particular area of the spine they will be operating on during your office visit. The spine is made up of individual bones called vertebrae. They are stacked on top of each other. There are 24 vertebrae from the cervical to the lumbar spine. 33 total vertebrae make up the spine. Functions of the vertebrae include protection of the spinal cord and internal organs, support for the head, shoulders, and chest, connecting the upper and lower body, balance and weight distribution, as well as flexibility and mobility. We will now discuss aspects of the preoperative phase before spinal surgery. It is never too early to begin preparing for spinal surgery. Preparations include attending spinal class or reviewing the presentation online, obtaining a medical clearance from your primary care physician or cardiologist, possibly donating blood, verification of insurance coverage for rehab, home health care, and durable medical equipment. If you're not planning to return home, visit any facility where you might want to go for rehab. In preparation for surgery, you will want to make sure you are eating well. A healthy pre-surgery diet consists of lean meats and proteins, fruits and vegetables, as well as whole grains. Drink 6 to 8 glasses of water daily to stay hydrated prior to surgery, unless you are on a fluid restriction. Limiting the amount of fat and sugar you eat before surgery can positively impact your healing and stabilize your blood sugar. Patients who have diabetes can benefit from tracking and controlling their blood sugar prior to surgery, as well as eating a balanced diet. As part of your surgery preparation, you will receive an Ensure Surgical Nutritional Bundle. The Ensure Nutritional Bundle helps to reduce wound complications, post-op infections, and overall days in the hospital. The nutritional bundle consists of Ensure Immunonutrition Drink, which starts 5 to 7 days prior to surgery. This boosts your immunity before surgery. Ensure Pre-Surgery Carbohydrate Drink, which is taken the night before and day of surgery, supports stable blood sugars during your fasting period prior to surgery. The Ensure Immunonutrition Drink after surgery starts right after surgery as soon as you are able to keep liquids down, and you continue this for 5 to 7 days after surgery. This supports wound healing by providing a source of protein and immune support. After surgery has been scheduled, there are several adjustments you may need to make to your environment to ensure safety. Clear out any objects in hallways or walkways to allow for safe movement from room to room. Remove throw rugs or loose carpeting that could cause you to trip or fall. Consider placing night lights in your hallways, bedrooms, and bathroom for safety at night. Most home accidents happen in the bathroom. Purchasing a non-slip bath mat for your tub or shower can help to decrease your risk of falling. Try to place kitchen and bathroom items at or around waist level for easy access after surgery. Arrange for a caregiver to assist with transportation, meals, running errands, paying bills, and taking care of pets. After surgery, set up a recovery center by choosing your favorite chair and placing your necessities within reach. Be sure to check with your surgeon that after surgery it's okay to sit in a recliner. Make sure you have plenty of entertainment, reading glasses, crossword puzzles, books, magazines nearby, as well as a box of tissues. Make sure you have a glass of water or snacks at your command center and a cellular or portable phone as well as the remote. Pre-operative testing is done before surgery to ensure you are in favorable health at the time of your operation. It also streamlines the hospital admission process following the completion of your surgery. This is the University Hospital Outpatient Center. If you are facing the main hospital, it is located directly to the right and has its own parking lot. You will enter the building, use the stairs or elevator up to the second floor, register, and meet with your preoperative nurse. After registration is completed, you will go to a pre-op room. This is where the pre-op nurse will meet with you to obtain a health history, and you will be given information about how to get ready for surgery. Your current and past medical history, as well as surgical history, will be reviewed and entered into your Epic chart. Remember to bring all your current medications in the original bottles or an up-to-date list of your medications to your pre-op appointment. It is extremely important for the pre-op nurse to record all of your medications correctly for your safety. You may have blood work, EKG, chest x-ray, or MRI done during your visit as ordered by your surgeon. You'll be given Ensure pre-surgical protein drinks to help boost your immune system before surgery. The pre-op nurse will give you a set of Ensure as well as instructions for drinking at home prior to surgery. A pre-op MRSA swab will be performed if ordered by your surgeon. MRSA is an antibiotic-resistant bacteria that can be carried by an individual unknowingly and not even cause illness. However, prior to surgery, patients are tested, and if positive, they are given an ointment to reduce the amount of bacteria in their nose. You will also receive a set of chlorhexidine wipes. These wipes are to be used on the night before your surgery as part of your surgical prep. You will shower as usual, towel dry off, then use the wipes. Wipes are used on all parts of your body except your face, hair, or private areas. Air dry before sleeping in clean pajamas and on clean bed linens. As you pack for surgery, there are several essentials you want to make sure you bring to the hospital. Bring your spinal booklet, back brace if you have one, current medications in their original bottles, or a current detailed list of your medications, personal toiletries, pajamas or robe, cotton t-shirt for wearing under a back brace, eyeglasses, dentures, and hearing aids. It is also important you bring something to pass the time while hospitalized. This may include a book, tablet, or any other hobby. Do not eat anything on the day of surgery. You should stop eating at midnight the night before. It is even a good idea to eat a light supper the night before surgery. Drink your last Ensure pre-surgical drink the night before and the morning of your surgery per anesthesia's instructions. No alcohol or smoking for 24 hours prior to surgery. Showering on the day of surgery is not required, but if you feel as though you need to take a shower before surgery, use non-scented soap and do not apply lotion, makeup, perfumes, nail polish, jewelry, hairpins, or deodorant. Do not shave or remove hair from any part of your body. Report to the surgery care center 2 hours before your surgery is scheduled. Bring your tube of nasal ointment if it was prescribed. On the day of surgery, you will come to the surgery care center located on the second floor of the main hospital. Drink your last Ensure pre-surgical drink before coming in for surgery or as instructed by anesthesia. As you check into the surgery care center, your identity and procedure will be verified. Then a patient identification armband will be placed on one of your wrists by the unit secretary. Once the nurse calls you back, you will verify your identity and procedure again. You will be brought to a private surgical care center room. Next, the nurse or a patient care assistant will give you another set of chlorhexidine wipes and have you wipe down in the same manner you did the night before. You will also empty your bladder in the bathroom and then put on a purple gown, non-skid socks, and a surgical hairnet. You will need to remove dentures, hearing aids, contacts, and jewelry. Blood work may be drawn and an IV will be started by the nurse. If the surgeon has ordered any medications for you to take before surgery, they will be given at this time. You will be visited by your surgeon, anesthesiologist or CRNA, and circulating nurse before going to the OR. The surgeon will review the plan of surgery and mark your surgical site. The circulating nurse will come visit you and will be the nurse by your side during surgery. The nurse will ask for a telephone number of the individual he would like to be contacted by the OR team. The anesthesiologist will visit just before you go back to the OR. They will give you a sedative through your IV to relax and calm you before taking you back for surgery. Here's an example of the purple gown we will give you to put on. It helps regulate your body temperature by blowing warm air into the gown to help you stay warm and comfy before, during, and immediately after surgery. The length of surgery depends on the type of procedure you are having. Your family will wait in the second floor waiting area unless there is a room assigned to the patient on the 9th floor. If so, they can wait there. The surgeon will either come to the waiting area or call to update your family after the surgery is completed. Your family will be given a computer tracking number to track your progress in surgery and also receive updates from the OR via text messages. After surgery, you will go to the recovery room for a minimum of 1 hour. You will wear oxygen and an oxygen monitor, have IV fluids, a blood pressure cuff on your arm, possibly a Foley catheter, and a hemovac or JP drain. The drain is in place to draw fluid away from the incisional site using suction, and it will be emptied by your nurse or PCA. When your vitals are stable and pain is under control, you'll be transferred to your room on the 9th floor. Preventing post-surgical complications is very important. You will use an incentive spirometer to help prevent pneumonia. This device works by helping open up your lungs and may cause you to cough. Your nurse will instruct you on how to use it before and after surgery. Generally, you will use the incentive spirometer 10 times per hour while awake. You will also have SCDs or TED hose to help prevent blood clots. They do this by circulating the blood in your legs. On post-op day 1, your nurse will come into your room early in the morning to draw labs so that your surgeon can view the results when he comes to visit you. When your surgeon visits, he will see how you are doing after surgery and assess any needs you may have. A regular breakfast will be provided as long as you are feeling well, not nauseated or vomiting. You will be provided a regular diet for the remainder of your stay. Generally, your oxygen pulse oximeter and IV fluids will be discontinued unless medically necessary. Your IV will stay in place until discharge. Oftentimes, the surgeon will order your drain to be removed on the first day after surgery. Vital signs are checked, and you will start taking your post-op Ensure protein shakes after surgery, unless restricted by your surgeon, and continue for the rest of your admission. Also, your surgeon may have you start to walk with physical therapy. On post-op day 2, your nurse will come in early in the morning to draw blood work so that your surgeon can view the results when he comes to visit you. Your surgeon will visit and see how you are doing. You will have a regular breakfast and meals. Vital signs are continued to be checked. You will start or continue physical therapy if ordered by your surgeon. You may possibly be discharged home or to a rehab facility this day. Following surgery, you will have a few precautions. Limiting sitting straight up to 20 to 30 minutes at a time. Do not bend, twist, or lift anything heavier than a half gallon of milk. No pushing or pulling heavy objects. Do not drive until your surgeon clears you to do so and you are off narcotic pain medications. Most surgeons encourage patients to walk to aid in the recovery process. Walk 5 minutes 3 times daily, increase by 5 minutes every 5 days. Your goal for walking is 15 to 20 minutes 3 times daily. Wear your brace as instructed by your surgeon if it is required. Please make sure you and your family use good hand hygiene. Keep your incision dry at all times. Have a family member or friend look at your dressing daily for 5 days, then every other day until you follow up with your surgeon. You may remove your dressing and shower when your surgeon instructs you to do so. This is usually 3 to 5 days after surgery, depending upon the surgeon. Shower as instructed, but no tub baths. After surgery, it will be very important for you to know the signs and symptoms of infection. A low-grade fever after surgery is normal, but anything over 100.5 degrees Fahrenheit is considered abnormal. With fever, you may also experience chills, so be on the watch out for both symptoms. Redness or warmth can be a sign of infection as well. This will be redness or warmth starting at the incisional site and spreading outward. After surgery, a level of swelling is normal. However, swelling that does not go away with rest and is painful can be a sign of infection. Drainage from your incisional site can be normal, but drainage that becomes yellow or green and has a foul odor is infection. We can arm you with the tools to help prevent post-op infection. The two main tools are hand hygiene and personal hygiene. Hand hygiene consists of washing your hands or using sanitizer before and after meals, after coughing or sneezing, after using the bathroom, before and after wound care, and also after touching pets. Personal hygiene is taking care of and cleaning your body, as well as the objects that come in contact with your skin. After surgery, it is important to change your sheets weekly or if they are soiled, as well as showering daily and wearing clean clothes. Follow your wound care instructions and avoid touching your incisional site except during wound care. Do not allow pets to lie on or near your surgical site, even if it's covered with a dressing. Keep all pets away from the incision until it is healed. Here we see post-op wound infections of the neck and spine. Post-op wound infections can become so severe that the site will open up and hardware can be exposed. These infections often require a second surgery and heavy long-term antibiotics. Start planning for discharge now. A case manager and social worker will be assigned to each patient to assist with discharge planning. You will need to plan who will transport you to post-op visits, someone to cook or provide meals for you, assist in showering or dressing, running errands, care for other family members or pets, grocery shopping, and housekeeping. Following hospitalization, your discharge plans will be based on physician preference and your ability. Our ultimate goal is for you to go home with family or significant other to assist in your care. You can also go home with home health care, home with outpatient rehab, such as a physical therapy center. Your physician, however, may recommend inpatient rehab. There are two types, subacute and acute. Subacute rehab, or a skilled nursing facility, you generally stay at the facility longer and the hours of therapy per day are shorter. Your insurance must approve admission to a subacute rehab, which occurs after surgery and is also based on your ability to work with physical therapy. Acute rehab, such as Walton Rehab or Doctor's Hospital inpatient rehab, consist of approximately 3 hours of therapy per day, and your stay in the facility is shorter. You must meet medical necessity, work with physical therapy, and have insurance approval. Here are examples of the different equipment you may need after surgery. Your physical therapist will evaluate you to see what equipment you need for safe movement. A rolling walker is used to help you walk and provide stability after surgery. Rolling walkers are ordered when recommended by physical therapy. You may or may not have a copay. A bedside commode or toilet riser can add 3 to 4 inches to your toilet height, which can make using the restroom easier after surgery. Back braces are ordered by your surgeon and are used with some surgeries for support during recovery. There are different types of braces, molded and hard-shelled. Call your surgeon with sudden severe pain in back or legs that is not relieved by your pain medication, inability to move arms or legs as you did in the hospital, sudden loss of bladder or bowel function. For any questions you may have regarding your recent surgery, if you have any abnormal drainage, yellow or green from your wound, or if your wound opens up or large amounts of drainage occur. Call 911 for chest pain, difficulty breathing, or difficulty swallowing. After surgery, you will have several appointments. These below are just guidelines and can be changed at any time. The need for each patient is different at every appointment. At 2 weeks, you'll possibly have staples removed. 4 to 6 weeks, a possible follow-up x-ray. At 3 months, possible follow-up x-ray. If PT or OT is needed, the office will order it at this time. 6 months follow-up for wound check and patient check, and a 12-month follow-up with your surgeon. Take pain medication as prescribed by your surgeon. Do not drive until the surgeon instructs you to do so. Avoid alcohol while taking pain medications. Drink at least 6 to 8 glasses of water a day if no history of cardiac problems with a limited fluid intake. Add fiber to your diet with eating fruits, vegetables, and grains. Continue to drink your Ensure protein shakes until they are all gone. They help boost your protein intake after surgery, which allows for better wound healing. Take a stool softener as needed per instructed by your surgeon. Don't forget to rest. You had major surgery and will need frequent rest periods each day. Make sure you set small goals each day and try to achieve them. And of course, give yourself time to heal. Thank you for your time. If you have any questions, please contact the University Hospital Orthopedic Spine Nurse Navigation Department at 706-774-5928. Thank you for insisting on the best and insisting on University Hospital.